Dr. here. The topic today is sickle cell disease, and I've tried as much as possible to dumb it down so that there are no technical terms and we're able to understand and going forward, tell someone who knows someone who is related to someone that has sickle cell disease and help them. All you need to know about it. And I'm sure by the time you're asking some questions, some other things will come up that I have not included in the presentation. So we're going to be looking at the outline this way. We're going to be looking at the definition, an introduction, the genetics. What is hemoglobin? We're talking about traits and inheritance. What's a disease carrier? What's a disease bearer? What is the mechanism? What are the symptoms? What are the complications of sickle cell disease? What's the diagnosis and what are the treatments? We're also looking at some future technology, what has been done going forward on sickle cell disease. So as an overview, sickle cell disease or sickle cell anemia is an inherited form of anemia. Anemia means low blood levels. So when we say anemia, we're talking about the blood level is too low to carry enough oxygen around the body. So a condition in which there aren't enough healthy red blood cells to carry oxygen throughout the body. And under normal circumstances, your red blood cells are flexible and round, and they move easily through your blood vessels. But in sickle cell anemia, the blood cells become rigid and sticky, and they look like a sickle. Sickle is that tool that I used to harvest wheat. In the village, we have it in Africa. We used to pluck mangoes and stuff off trees. So it takes that sickle cell shape, which is rigid and not flexible, and these cells can get stuck in small blood vessels, can slow down or block blood vessels, and stop oxygen from getting to the parts of the body. How that happens and the consequence of that, we'll be looking at it later. So, sickle cell disease is a genetic disorder that affects the red blood cells, causing them to become sickle or crescent shaped. This effect is because of the abnormality in the hemoglobin molecules. Hemoglobin is the base unit of the red blood cell and it's made of two units. Hemoglobin is made of two units, the heme, the iron that you take as supplement sometimes, and the globin unit, which is the protein unit. And what hemoglobin does is that it helps you carry oxygen around the body and nutrients. So when you have a hemoglobin in the lungs, for instance, it bonds to the oxygen and goes to the cells and releases it. When the oxygen is bonded to the hemoglobin, we call it oxyhemoglobin. So when you look at blood and you look at the blood, it's brightly red, especially in the arteries, because they're just coming from the lungs, just newly collected oxygen. But when they are coming back from the blood vessel back to the lungs, that is, they've released the oxygen they have, we say they are reduced, they look bluish or purple. So that's why you look at light-skinned people. If you look at their veins look a bit bluish. So these are basic knowledge that we should know, and all this basic knowledge will help when we're talking about some of the consequences and some of the complications of sickle cell disease. Now, the hemoglobin itself is made up of 4 iron molecules. So when we say heme, we're talking about iron. Heme refers to iron, while globin is amino acid in a chain. So amino acid, of course, we know it's the basic form of proteins. So I'm trying not to be too technical so that we can understand these basics. The red blood cell, why we call them red blood cell, and why the blood is red is because of the iron in them. And as you can see in this diagram, iron is the main core, while those bluish and I don't know what ladies you call this color now, teal color, is the amino acids. So heme contains iron and gives red color to the blood, while the globin consists of protein. We will know the importance of the globin later when we are talking about anemia and sickle cell disease. There are so many types of hemoglobin. We have just 2 broad groups. There's the normal hemoglobin, that is hemoglobin A, hemoglobin A2, and hemoglobin F. Hemoglobin F is the one you have in children, newborns, while the SCE and over 350 types of hemoglobin that are abnormal. So when you hear someone telling you that, oh, my genotype is AE, don't look at him like he doesn't know what he's saying. He may know what he's saying. What is the genetics of sickle cell disease? Remember we talked about the structure, iron connecting with amino acids. It has been seen and has been discovered that a change in the cell structure, that is the change from the normal round red blood cell to the sickle-shaped cells, is as a result of a change in the structure of hemoglobin. So as little as one amino acid change can cause the whole cell to change structure. For instance, for sickle cell, for hemoglobin S, we can see that just one unit, just one part there from the glutamic acid is changed. If you can see my arrow, just this single one is changed, is mutated here and makes the whole cell to change its shape. You can imagine, just one tiny amino acid, something that you cannot even see with your naked eye, is changed, is switched by mutation. And because of that, the whole cell is damaged. That's what happens in sickle cell disease. It's a mutation of one of the links. And because of that, the whole cell has become denatured or destructured. And when we say a single change in amino acid causes hemoglobin to aggregate, aggregation means that these cells will clump together and block the blood vessel. And once they block the blood vessel and blood doesn't pass through, whatever access they're supposed to get at the end is going to be blocked. So no oxygen, no nutrient to whatever organ is at the other end. We're going to talk about a very important aspect of sickle cell anemia and sickle cell disease. We know that it's genetic. It can be inherited from mother to child, from father to child. Well, how exactly does it cross? Before I go into this, we'll be talking about traits and disease. When we say trait, we're talking about, oh, this person has a marker, the gene for the disease, but he's not having the disease. So when we say things like sickle cell traits, that is when you look at this person's blood, he has the sickle cell gene, but it's not dead, it's not manifesting as a disease. So when you hear people say AS, AC, AE, they have the trait, but they're not showing the disease. That's why sometimes when someone is AS, you cannot differentiate them from someone that is AA until you do a blood test. For instance, if one parent, let me move my camera closer. If one parent has sickle cell trait, HbAs, hemoglobin AS, and the other does not carry the sickle cell hemoglobin at all, that is AA, none of the children are going to have sickle cell anemia. That is, none of them will come down with the disease. But there's a 50% chance, that is 1 in 2, that any of the children will get a copy of the HbAs and have the trait. And also, there's a chance that some of the children will not be affected at all. So let's refer to this diagram. In this diagram, you can see that it's the mother that has the sickle cell trait. Each time the mother and father come together, that is, if they have intercourse, there's a chance of AA, AS, AA, or AS. That is, none of the children. For instance, the mother here does not have the disease. She only has the trait. So she may look normal as AA. She may have all the features of AA. She doesn't fall sick. She doesn't get tired. No bone pain, nothing. But she got married to an AA. Now, each time they have a child, the man gives one of his A, the woman gives one of her A. They have AA. The man gives one of his A, the woman gives her S. They have AS. The man gives another A, the woman gives A. These are possible outcomes. Now, I hear a lot of people saying, oh, it's only if I have 4 children, that means it's only 1, or it's only 2 that will be AS.
and 2 will be normal. It doesn't work like that. Each time you have a child, the body goes through gambling. So it's possible now that all these 4 children or all the 5 children are all AS. It's possible that all the 4 children are all AA, because each time the child is conceived, you cannot predict which of the genes will be passed down. So I've seen someone that AS married AS and all the 4 children were SS. In fact, one of them even died. So these are just possible outcomes. Doesn't mean that you have 2 AS and 2 AA. No. It means that each time you can have AA, you can have AS. This is if an AA gets married to an AS. And this is what genetic counseling is about. We tell parents or people that are planning to get married, know your genotype, plan it ahead. So let's go to the next scenario. What if both parents carry the trait? Remember I said the trait means the person has the gene but is not having the disease. So what are the possible outcomes? If all of them have the trait, it means that 1 in 4 chance that the child will have SS, that is sickle cell anemia, and there's another 1 in 4 chance that the child will be completely normal. There's also a 1 in 2 chance, that is 50% chance, that the child will get the sickle cell trait. So back to my diagram. Look at the outcomes. And I tell people, look, do you want to gamble with your child's life, or do you want to gamble with your own peace of mind? Saying that so long as there's a possibility, we can do what we want. Look at this, for instance. His father has a sickle cell trait. He looks normal. He walks normal. There's nothing wrong with him. Doesn't fall sick easily. Doesn't have any problem with his body. The woman too looks normal. Has no low blood levels. She walks normally. She doesn't fall sick easily. But when they now come together, AS, the chances that they will have AA is just 25%. That is 1 out of 4. There's a 50% chance that they will have children that have AS. And there's also a 25% chance that they will have a sickle, a child that will have anemia. The problem with this Dan, is that at any point in time, you don't know which of the children will have ASSS. So if we say, no, Shibi, doctor has told us that anyone can also have AA, and we are praying for AA. What happens if all the children come out with SS? So it can happen that all these children are SS. It can happen that all these children are AA. But you want to take the chance with your children's future. Let's move on to the next scenario. Now, a man is AS, and he wants to get married, and he gets married to a lady that is SS. That is, the man has a trait. He gets married to a sufferer already, someone that has anemia, that's a sickle cell patient. Look at the outcome. They will not have any normal children. They have 50% chance of having carriers they have the trait, and they also have 50% chance of having sickle cell disease children. So this is even more risky, because the chances that they will have sickle cell anemia children is even 50-50. And I've seen people like this that they didn't give birth to any normal child. This is also very risky, because when we are looking at some of the complications and some of the symptoms, you see that the child cannot live a normal life. He'll be shuttling to the hospital. The parents will not live a normal life. They'll be worried. They'll be concerned about their children. They can't leave their children. They have to be monitoring every time. So it's a long life of hustles and suffering. So, like I said, if one parent has sickle cell trait, that is the HBS, and the other has sickle cell anemia, the SS, there's 1 in 2 chance that any of the children will have sickle cell trait, and also another 50% chance that any of the children will have sickle cell anemia. No children will be completely unaffected. What if someone that has AA marries someone that has SS? What is the likely outcome? If one parent has sickle cell anemia and the other is completely unaffected, then all the children will have sickle cell trait. None will have anemia. Remember, we talked about trait means you have the gene, we are not manifesting the disease. The parent who has sickle cell anemia can only pass the sickle cell hemoglobin gene to each of their children. So look at the diagram again. We're back to the diagram again. The man is completely normal and the woman has sickle cell anemia. It can be either way around. All their children have traits, but all these children are going to be normal, healthy children. They just have the trait. They will not manifest the disease. So that's why we tell people, look, if you have SS, the only person that you are allowed, that you be reasonable for you to get married to, forget love, forget, oh, it's the love of my life, is an AA person. An SS person, you cannot go and marry someone that is AS because you are risking the chances that you give birth to sickle cell patients. An AS person should not get to marry to an AS person. You're also risking the chances that you may have an SS children as outcome. An AA can marry an AS, either man or woman, because they will give birth to healthy children. Remember that someone carrying the sickle trait would not be sick. So this is normal. Two normal people looking normal get married. AA and AS. This is the possible outcome. Two people looking normal, but they both carry the traits, should not get married because there's a chance that they will pass on the sickle traits, both sickle traits, to the child and have a sickle cell sufferer, that's an anemic patient. Also, someone that has sickle cell already, that's already anemic, should not get married to someone that has a trait, for the same reason that they have a higher chance of producing sicklers as children. This is very important when we are counseling people. I had a friend about 10 years ago. She was like, oh, I love him so much, but she was a sickler and the guy was SS. Oh, I love him so much, I'm going to do anything to marry him. And I told her, look, you know how many times you go to the hospital. You know how many times you take medications, you have crisis, you fall sick, you can't go to work, you have ulcers on your leg. Imagine that for your child every day of their lives. Yours is there, you're not doing that for your child again. When you had an option to save that child's life. Eventually, she didn't marry the guy. She got married to someone that has AA. And they're better off for it now. If you are SS or AS, the only person that is reasonable and fair for you to get married to is AA, whether man or woman. This is basically the component of genetic counseling. When you say, okay, you want to counsel people on knowing their genotype and who to marry. And most organizations will tell you, look, if you want to get married, you want to know your genotype. Apart from the HIV status, you want to know your genotype. Blood group is not usually that complex because blood group, you can easily take medications, you can give you injections before you give birth and the rest. How does the sickle cell form actually? What's the mechanism behind it? And when we say, oh, it blocks the red blood cell, it does this, what exactly do we mean? Now look at the HbS, the hemoglobin cell, hemoglobin S. We see when it gives out its oxygen, it's coming from the lung now, it's normal, it's looking normal, coming from the lung. It's looking normal. Normal disc shape, it looks normal, it can go into blood vessels, it can squeeze, it can change shape, it can narrow, it can open up. But once it has given away its oxygen, it's now become sickle shaped. It cannot go through this blood vessels anymore. It clogs it and blood clot begins to form. It blocks that place, blood cannot get to where it's going. The organ will suffer nutrients, oxygen loss. And you can begin to imagine the complications from that. When sickle hemoglobin gives up its oxygen to its tissues, the HbS stick together. It forms long rods inside the red blood cell, and the red blood cell becomes rigid, inflexible, and sickle shaped. And as we have seen, it's unable to squeeze through the small blood vessels and blocks them. Less oxygen, less nutrition. That's what happens. Also, the red blood cell that have the sickle cell gene or sickle cell disease in them have a shorter lifespan. Every human being, your red blood cells usually change, renew itself every 90 to 120 days. So for about 3 to 4 months, your red blood cell is alive doing its function. But for people that have sickle cell anemia, remember what you call anemia. Anemia is reduced red blood cell, reduced hemoglobin. Because of the reduced oxygen and the type of structure the red blood cells have in HBS, that's sickle cell trait, gene, these cells are now shortened to 10 days. So imagine instead of your cells to be living 3 to 4 months, they are now living just 10 to 20 days. Which means that the cells will be destroyed every 10 to 20 days and they are not enough. So most people that have anemia, sickle cell anemia, are usually looking pale at almost every time of their lives. Pale means their eyelids, their skin look a bit whitish, their palms look white. Because the cells die every 10 to 20 days. So they're in a chronic state of anemia. So always, anytime you do their blood levels and you do the investigation in the lab, you get values like 13, 17, 16 for an adult, 20 for an adult, instead of the normal level of 36 to 54 for men, 36 to 42 for women, 42 to 54 for men. What are the symptoms of sickle cell anemia? What are those features that will say, oh, this must be sickle cell anemia? And what are those things that happens in the body? Number one, anemia. Remember, we're talking about low blood cells. Because these cells are weak and the structure is different, they break apart easily and they die easily, 10 to 20 days. So the person doesn't have enough red blood cell, the body cannot get nutrition, the body cannot get oxygen. So the person that has sickle cell anemia is always tired. You can see them, they cannot play football like other people. They cannot run around. They get affected by cold. Any small thing, they'll tell you, oh, look, I'm tired, I cannot do that work anymore. Pain. Now, this is a big topic and we have to explain this in detail. For pain, we call it crisis. And what happens is that the sickle-shaped cells that block blood flow cause a lot of damage to the cells that the vessels are supposed to go to. There's pain in the bones, in the blood vessels in the chest. There's pain in the abdomen. There's pain in the joints. All these are as a result of blockage of blood vessels by these sickle-shaped cells. Some people may have mild pain. Some people may have severe pain. And some people's pain may just last few, while some people may have long-lasting pain. Some people will need to be hospitalized, need to be sent to the hospital, to be admitted for long periods, and put on strong pain relief medications. People also have ulcers that will cause pain, joint damage. Some people have swelling of their hands and feet. What happens is that when the blood vessel has been blocked, there's no fluid passing through. There's inflammation going on. The hands, the foot are swollen. These people can have frequent infections because the spleen that's supposed to fight infection has been damaged. Remember, I talked about the blockage of blood vessels by those cells. So these people are vulnerable to infections, and because of that, doctors will give them antibiotics, vaccinations, just to prevent infections. So they have to go to the hospital frequently for checkups. For instance, pneumonia, they have to be going to the hospital to check, oh, I fall sick, cold, influenza, catarrh, joint disease, bone disease. They're always going to the hospital for one thing or the other. That's why they have to be on antibiotics so that those common infections will not affect them. Delayed growth. Delayed growth
Like I explained that the red blood cell carries nutrition and oxygen around the body. So when the red blood cells are in short supply, nutrition and oxygen will be in such short supply, this child will not be able to grow the normal way. You notice that children that have sickle cell disease are usually slower in growing compared to their counterparts that are healthy. Delay in puberty also in teenagers can occur, while slow growth occurs in children. Vision problems. Still talking about the blockage of blood vessels, the tiny blood vessels. One of the organs that has the tiniest blood vessels are the eyes. Imagine if the sickle-shaped cells block those vessels that supply the eyes. The retina that is responsible for it to actually see will have a problem, and it can lead to blindness if not taken care of. These are features, are some of the symptoms that you can see. Some people may have some people may have all, but some people may not have all these at all, may just be the pain. Like I said, the pain varies in people. So I talk about genetic counseling. Genetic counseling is, oh, by the time you are saying I love you, or I want to spend the rest of my life with you, oh, I think you are the mother of my children, oh, I see my future in you, all the lyrics, before you drop all the lyrics, know the genotype of your partner before you guys start building castles together and end up finding out. I've seen a colleague of my friend of mine back home. They had already prepared, they had done their introduction, getting ready for wedding, only for them to discover that their genotype AS and AS. Unfortunately and sorrowfully, they had to dissolve the relationship. Know your genotype and your partner's genotype. It's important. It is not being over science, and we are not saying that you should not pray. But we are saying that you have the wisdom, you have the knowledge. Know it now. By the time you are taking each other out on dates, the question should be asking, what's your genotype? If you're not sure, let's go and find out. So what are the complications of sickle cell disease? We talked about organ damage. Organ damage is as a result of the blood vessels being blocked. An organ that is not getting nutrition, is not getting oxygen, will eventually get damaged. Kidneys, the liver, the spleen, the eyes, we talked about that. They can have leg ulcers. This is open sores because the cells themselves or the tissue are not getting enough oxygen, so they die off. They can result in gallstones. Remember, we talked about the cells dying off every 10 days or every 10 to 20 days. And when the blood cell is broken down, it forms bilirubin. Bilirubin is processed in the gallbladder, just under the liver, and forms bile. When it's too much, they can form stones. And for people that have had family members that have gone for gallbladder surgery, it can be painful, it can be terrible. So they can have gallstones as a result of high bilirubin. And apart from blindness, it can cause stroke. Imagine if the blood vessel that was blocked is in the brain and there's no blood supply to that part of the brain. Just imagine that. There'll be a blockage and the person will be paralyzed on that side that the brain is supposed to supply. How do you diagnose? How do you say, okay, I know of a fact and I know surely that this person has sickle cell disease or sickle cell traits? Usually blood test to check for hemoglobin S. And I'll show you how hemoglobin S is formed by the amino acid change. You want to do a blood test. In so many countries, they wait till after the child is 6 months because we know that for the first few months of life, the person is having hemoglobin F, which is a fetal hemoglobin from the pregnancy. And if it's not done by a professional, you may not be sure what you're looking at. You may say, oh, the person is normal. Meanwhile, the person is not normal. But after 6 months, we expect that all the hemoglobin the person brought from the mother, the fetal hemoglobin, has died off. The person is now carrying his own hemoglobin. So you cannot do at that point at 6 months that, okay, let's look at what hemoglobin this person has. If the screening test is negative, as if you've gone to the lab and they tell you it's negative, that means there's no sickle cell gene. Enjoy your life. But if the screening test is positive, we want to know, is it a trait or is the person actually a disease sufferer? That is it AA, AS, or SS? And at that point, you now check, okay, what is the percentage of red blood cells this person have? Is the person's red blood cell low? We call it PCV. Also, when we want to do the diagnosis, we can do prenatal investigation. That is, the woman is pregnant already. We want to know if the baby she's carrying is going to be sickle cell or normal. So we tell the woman, come to the hospital at between 14 and 16 weeks. A sample of the amniotic fluid, that is the fluid that surrounds the baby in pregnancy, is taken. And genetic studies are done on it. It will tell you within 1 to 2 weeks if this baby you're carrying is going to be sickle cell or a carrier or a normal child. We tell the woman also, another thing you can do is very early in your pregnancy, you can come, want to look at the fetal DNA by taking a sample of part of the placenta, because you know the placenta carries the same genetic component as the person. You want to do a chorionic virial sampling or CVS. You want to also check, and within 2 weeks, they can tell you, oh, this baby you're carrying is going to be SS, or it's going to be AS, or it's going to be AA. You have no worries. These are done while the woman is pregnant, as she had already done. Oh, she didn't know before she got pregnant. What is the treatment? How can you treat sickle cell disease? Now, we will not talk about treatment if we are not talking about the disease. Someone that has AS does not need treatment. The person looks normal, lives a normal life. Treatment is usually for someone that has the sickle cell disease. What is the treatment aimed at? We want to avoid crisis, that is the pain episodes. We want to relieve the symptoms. We want to prevent complications. That's why we treat. According to the Center for Disease Control, children older than 2 years and adults with sickle cell anemia should see the doctor at least once a year. For advanced countries, if the treatment are done properly, these people will not have to visit the hospital more than once. But because of low income countries, low economic state of parents or people, they don't take care of their children, they have to go to the hospital frequent number of times. This is the aim of treatment. Now, one, we want to do pain relief. We want to prevent complications. That is, we give antibiotics because you know they easily fall to infections. We want to give vaccines. We mentioned the pneumococcal vaccine. Your doctor will explain some of the antibiotics and the vaccines to you. Some of them may need blood transfusion because if the blood level is too low, the person may have a problem surviving common illnesses. The person may have problems surviving just stress, oxygen stress, or oxygen reduction stress. So you want to do blood transfusion because you know that when you transfuse this person, it can help prevent stroke. And imagine someone coming to the hospital and is looking white. The blood, you do a PCB that's supposed to be a blood investigation that's supposed to be maybe 37%. You count the person is 3% or 2% or 5%. Then you are wondering what's the problem. You also want to do a bone marrow transplant. Of all the treatments, bone marrow transplant is the only one that provides a cure. That is when it's successful. It's the only one that provides a cure. All the treatment we are saying is just to maintain the person's quality of life, not to treat, not to cure. When we say cure, we mean that something you do for the person that the disease will not exist anymore. And we do this for people that are younger than 16 years old because you know that in this age, the risks are less. Risks include death. So for people younger than 16 years old, we want to do a transfusion from them, blood transplant for them. And the bone marrow transplant can be gotten from the bone marrow of a compatible donor or from the placenta of this person that has been stored earlier. Looking ahead now, because someone mentioned that, what is the new research? There are so many experimental treatments going on, so many, but they fall into two basic categories. One is gene therapy. We insert a normal gene into the person's bone marrow so that the person will begin to produce normal red blood cells. Or we look at the person's DNA and want to switch off the defective gene that is making the person produce the wrong type of hemoglobin. These are researches still going on.
What is the lifespan of one living with sickle cell? They can live normal lives depending on the kind of care they receive. But we have said that the median age for the men is 48 years, and while the woman is 42 years. The median